is like a thief. It enters your body and robs you blind. It takes away your hobbies, your friends, even your marriage. Left unapprehended, it takes away your days and nights and leave you hopeless, wanting to die. Pain affects more Americans than diabetes, cancer, heart diseases combined together. We spent over $500 billion on pain alone in the US. Life without pain sounds great, right? Not at all. Actually, it's extremely dangerous to live without pain. You could hurt yourself without knowing. You could prevent a broken leg from healing by walking on it. Pain is essential to our survival. However, when pain persists for a very prolonged period of time, it loses its value. It serves no purpose at all. When we talk about back pain, it affects almost 80% of the population in the US at their lifetime. Luckily, 90% of us have our pain resolved within 3 months. 10% go on to have chronic back pain, as we call it. It is the #1 reason for disability of Americans under the age of 45. It's the #2 reason to see a doctor after a common cold. It costs us a lot. Today, we spend over $100 billion a year to treat back pain in the US, over $220 billion worldwide. Could you imagine what you could do with $100 billion? We talked about feeding the hungry kids. We could feed all the hungry people in the world for a full year with $100 billion. Or we could buy Disney World, so we don't have to stand in line, right? We treat pain today with medications, epidural injections, and fusion if everything fails. Drugs are addictive, and they have a lot of side effects. We make 5% of the world's population, yet we consume 80% of the opioid production worldwide. We use 99% of the hydrocodone production. Hydrocodone is the main ingredient in Vicodin. Between Vicodin and other opioid painkiller, we kill more people than car accidents in 17 states. Did our level of pain, are we suffering more than anybody else in this world? Is our tolerance limit went down, so we are using all of these drugs? Are we way off the chart, or the rest of the world is off the chart? In 1995, my mother, who was in Jordan, she was diagnosed with stage 4 cancer. As you would expect, they treated her with chemotherapy, radiation therapy, and they managed her pain with ibuprofen. Ibuprofen for cancer pain. Nothing is worse than seeing your mom deteriorate before your eyes, and you can't do anything about it, because her doctors refuse to prescribe opioids. We have a problem inside the US, and I think we have a problem also outside the US. The pendulum has swung too far inside and outside. Today, when we talk about epidural injection and nerve blocks, the success rate for back pain is around 50-50, flip of a coin. A little bit better than the roulettes, but it's still a 50-50 chance. We do over 10 million blocks a year in this country with a chance of 50-50. Spine surgery, slightly better chances. It's between 50 and 70%, depending on the pathology you're treating. But still, the odds are low. We must find better ways. We must find better diagnostic tools. We must find a better match for the treatment, patient selections. We must find drugs that they are less addictive and more effective. Today, when it comes down to pain measurement, we're extremely archaic. We have a scale from a 0 to 100. 0, no pain. 100, the worst pain you could ever imagine. And we ask a patient, how do you feel? Where do you fit on the scale? So if I grab a stick and hit you on the head, 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 and ask you, tell me, what is your pain scale? You will be all over. That's what he paid for sitting in the front row. Our experience of pain, most probably, it is likely with a gene that we're born with and modified by our life experiences. Just imagine when you were a kid, running in a soccer field, flipped, tripped, hurt your knee. Your mom is sitting on the sideline, she rushes to you. Oh, poor baby, show me here. Does it hurt you too much? Versus sitting on the sideline and clap you. Way to go. Get up, start moving. The experience of pain there, it's totally different. That experience will be engraved in your brain and will be called upon the next time you fall down. And your brain internally is going to compare notes and tell you how much it's going to hurt you. Other factors that affect our pain experience is age, gender, and race. Females have a lot lower pain tolerance than male. However, thank God you have a lot more endurance. 9 months of it. Otherwise, we wouldn't have babies born on the face of earth. When we think about other factors, you have to think about cognitive factors, attention and distraction. This picture here, you'd see around Ronald Reagan when he was shot. Actually, halfway to the White House, he didn't know that he was shot. The Secret Service sitting next to him noticed that he was bleeding, and he took him to the closest hospital. Your attention affects the way you perceive pain, even how you feel it. Pain is very personal. It is whatever you say it is. It's wherever you say it is, and whenever you say it is. If you say it's hurting me here, it is hurting you here. If you say it's hurting me too much, it is. If you say it hurt me an hour ago, it did. Nobody can argue with you. That's why pain is so hard to diagnose and treat. When you sit down and start thinking about pain, there's other factors. Pain, by definition, is unpleasant sensory and emotional experience. Emotional. Emotional pain is when you lose a loved one. It hurts, and you feel it. When we talk about pain, it has a different component. It's not only physical, it's not sensory, but there's the emotional component of pain. The longer you're exposed to pain, the more it's etched in your brain. That emotional component stays even after a wound is healed. Say you did a decompressive surgery for your spine. The physical component is already gone, but the emotional component that engraved in your brain, it's still there. A good example of that is the phantom limbs. Say somebody had a gangrene and it was painful before they amputated the leg. The pain persists after they amputate the leg. There's a representation of our body inside our brain. Actually, the leg sits here. That leg is still there. The leg is gone. However, the pain is still there. Your brain is a sophisticated pharmacy. It produces all kinds of drugs, actually some very potent drugs. It produces enkephalins and endorphins that they block actually the opioid receptors, so your pain is not going into your cortex and your brain, and it blocks it totally. Your brain produces cortisol that affect your mood and stress levels. You have a cabinet in your head that it is locked. Exercise, meditation, active relaxation are some of the keys to open that medicine cabinet and help yourself. We've known all along about the clinical trials, the placebo effect. The body heals itself. It's well documented in the placebo trials. We have the power to activate our brain and get it moving. Physical activities, there are so many studies showing the effect of physical activities on back pain and improvement in back pain and increasing also the tolerance. Have you ever run a marathon or a triathlon? Did you ever get that euphoria, the runner's high? People talk about that by the production of the brain of enkephalins and endorphins. They give you that runner's high. Your body and your brain are highly stimulated. People describe it as orgasmic feeling. No wonder we have a runner's addictions. But not everybody can run. If you think about somebody with an arthritic knee, we talked about arthritis here and arthritic knees, they can't exercise that much. The real winner in alternatives is meditation. A lot of people use meditation and prayers, spiritual connections, to cope with pain and relieve their pain. Cortisol is produced when you do meditation. There's some studies actually showing gray matter density higher in people who meditate. Even your brain gets denser. I mean, this is something that is wow, but it's reality. You have the data to support that. We have to think about pain, and we have to think about how to treat it. A multidisciplinary approach where you're doing your decompressive procedure and healing the tissue is important, but you have to address the emotional and psychological aspect of pain as well. You and you alone have the power to unlock your medicine cabinet. You're in full control of your brain and body. A little prayer here, a little exercise there, and some meditation may go a long way. Thank you.